The news no Kings fan wanted to hear. De'Aaron Fox broke his finger in Game 4 against the Warriors. So what kind of break is this, and what is the usual prognosis for recovery? Dr. Dana Shang is a sports medicine specialist with Dignity Health. She joins us now live to explain. Doctor, thanks so much for joining us. I appreciate it.
Thanks for having me, Richard.
Okay, so the team says this is an avulsion fracture, if I'm saying that correctly, but it looks like the tip of the finger was broken here. Is that a familiar break for basketball players?
Yeah, it's a pretty common injury, basketball and other sports as well.
What is the recovery? And to be clear, you're not De'Aaron Fox's doctor, not a team doctor, but you can give us some insight. You've seen a lot of these. What kind of recovery, best case, worst case, should we be expecting?
Yeah, as you said, hard to say without all the details of the case, but right. Treatment for finger fractures can really vary depending on how bad they are, from rest ice elevation and simple splinting to lighter splinting around the finger to a larger splint or cast. If they are able to play with this, and then in the NBA, you have to have a lot of padding if it's going to be a hard splint or cast to prevent injury to other athletes.
So, I mean, so it can run the gamut depending on his pain level, depending on his threshold. But De'Aaron Fox is an incredible ball handler, incredible shooter. If they have a cast or something on that finger, that could affect play time. And I guess going into this, it looks like we're going to have to play at least 2 more games for this. And a team has to make a hard decision. And as a doctor, does this the kind of injury that you want to see the patient rest immediately, or can they play through something like this, depending on the injury?
Yeah, depending on the injury, I mean, as you said before, it varies, but ideally there's the rest. But in a situation like this, you have to consider the level of the athlete, where they are in the season, as we talked about. Right. So ideally, if they are comfortable and the doctor is comfortable, then they could potentially get back into play.
And we've seen some other players play with this kind of fracture. Hopefully, as a Kings fan, I want him to play, obviously. But as a doctor, I'm guessing you probably want him to rest, unless you're a super Kings fan like a lot of us are. But, I mean, it's important to note that a lot of people, and sports are a big thing. These kind of fractures happen in all sports. If this happens to you or your kid, you want to make sure that they make sure and take care of it. Because if they don't, and they play through it, the risk of injuring it worse is there, right?
Yes, that is correct. You can worsen the injury. You could get a new injury while you're already trying to heal from the fracture. You could end up with deformity, prolonged pain, earlier arthritis, depending where the fracture is. Yeah.
Oh, so there's a lot to consider that the Kings got to do right now. Dr. Dana Shang, thank you so much for helping us out, a specialist in sports medicine. Thanks so much for talking to us today. I appreciate it.
Thanks, Richard.
8:27 right now. Governor Gavin